Good afternoon and Happy New Year. I'd like to welcome back and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 4th of January. And we invite you to continue to submit your questions to us, both via Facebook at NU Institute for Global Health and via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. I'm going to jump right to a very scary number. Yesterday in the United States, we had 1,003,043 new cases in just one day. Unfortunately, the vaccination rate is still at 62% for the United States. And we are now seeing an average of 7 days of 400,000 COVID cases per day with an increase of about 204%. Hospitalizations have increased by 55%, deaths have increased by 24%. And yesterday in Illinois, we saw a record number of 89,157 new cases, with 64% of the population in Illinois fully vaccinated. These are incredibly scary numbers, Dr. Murphy. The numbers in New York, the numbers in Washington, D.C., the numbers in Illinois, the numbers in Michigan. I mean, what can you tell us about when the heck is this going to peak?
Yeah. First of all, yeah, that is a phenomenal increase. It's certainly spreading like wildfire. It's like a flash flood, as others have called it. Yeah, there's no wave here. It's just like skyrocketing. Now, part of this big number may be due to the sort of this holiday factor. You know, people just got through New Year's Eve, New Year's Day, the holiday weekend. They just came back really to work and back from the holiday yesterday. So it could be that this is sort of a bunched up bunch of numbers from last weekend and the whole holiday week. It could be a holiday related phenomena, really due to timing. So I mean, regardless, this is just like way too many cases. It's just showing how contagious this thing is, and the fact that we're not taking it seriously enough in this country, and many places around the world as well. But the United States is doing particularly bad because of the lack of uniformity in the mitigation process and the suboptimal vaccination uptake. That will be improved now, as you mentioned, that the 12 to 15-year-olds can get boosted. Ultimately, under 5 will get vaccinated when they figure out the appropriate safe dose. But, you know, we still have, you know, nationally, 35% of the people, at least, are not vaccinated, 35 to 40%. That's what's driving this thing. So, you know, in Chicago, starting yesterday, you want to go in any kind of place, even if they serve you a bottled water, you've got to show your vaccine card, or the new app they have. That's going in the right direction. But, you know, this is sporadic around the country, and there's a lot of places that are not going to do that, and places that don't mandate any of these mitigation efforts. And if that's going to happen, then, you know, these numbers, you're going to see it even get worse. So take care of yourself. Basically, every person for themselves, you know, protect yourself. Now, if you have an underlying immunocompromised condition, you're over 65, you have any kind of medical problem, you know, you've got to be really careful, because you're at risk for these breakthrough infections that could hurt you. Unfortunately, with these vaccines, they're not working good enough to prevent infection, but they are preventing severe disease. But if you have an inability to fight that disease, it could be devastating. So like in the hospitals now, 80% of the people, this is a rough number, but it's high, like 85%. Are unvaccinated people. They're just going to get it and get sick. And they're younger and they have less high risk factors. If you're fully vaccinated, those people are really, really sick. They have serious underlying, typically have serious underlying medical problems, which puts them at risk. So please be careful. If you are at high risk, and if you're not at high risk, you don't want to go out there and get this thing. Having COVID is not good. We don't know the long term, how many of these people are going to be long haulers and have symptoms for 6 months. We don't know. Plus, they're going to continue to spread the infection. So it's really a catastrophe.
It really is. But unfortunately, one big headline is saying that it won't be pandemic forever. What could be next, Dr. Murphy, after this?
All pandemics end. You study any pandemic, there's been many pandemics. They all come to an end. For some reason, the population gets relatively immune, like influenza. I mean, the last pandemic for influenza was 1918. And that lasted for almost 3 years. There were 3 big waves, and it just disappeared. You know, the immunity got there, and the virus mutated, and it was not as lethal, especially to young adults, which was a particular feature of that pandemic. And the movement of people related to World War I and the troops moving around back and forth. So, but all pandemics will ultimately end. And it's thought, one of the models shows that this will be somewhat like the flu, that there will be this immunity due to the vaccines and the people getting infected all the time. But we don't know if it's going to be exactly like the flu, or we're going to have to continue, but most likely we're going to have to continue with these vaccines lifelong, just like we do with the flu now. We haven't been able to eradicate the flu, and we're not going to be able to eradicate coronavirus now. Those days are long gone. So that's the future, but it is, the pandemic will end.
Yeah, especially now that it's, certain states are mandating the booster. So for example, the new mayor of New York is considering mandating the booster for all city workers.
Yeah, I mean, it's clear now. We didn't know at the beginning. This is an emergency situation, that these vaccines are not effective until you get all 3 shots. And that's when you've got some protection. And so we're calling it, it's really a misnomer to call it a booster, but we got to get over that. But the 3 shots is like mandated, like in many other infections and other vaccines that people take. They take 2 or 3 shots. The science world figures out what's the optimal regimen and vaccine strategy, and we're just figuring that out now. But 3 shots is the minimum. And with COVID and with Omicron, the difference between having 3 shots and 2 shots is dramatic. It's tenfold difference for hospitalization and death, at least. So you've got to get that booster shot. And that's why the mayor of New York is saying, hey, you're not fully vaccinated until you have 3. And this is the way it should be.
Right. And this even ties, closely into our next big headline that the FDA has approved boosters for children 12 to 15. I know you mentioned this earlier, but can you tell us a little bit about how this is going to affect the pandemic moving forward?
Well, I mean, this will help. And then we'll have to get down to the kids 5 to 11 as well, because any unvaccinated or suboptimally vaccinated pool is going to continue the pandemic. So we want to boost up the immunity in all these groups. Yeah. And that's going to help. And then ultimately we'll do kids 6 months to 4 years. But those first trials didn't work.
Right. And our last big headline is why one needs to upgrade their mask as Omicron variant spreads even more and more and more. Can you tell us about the masks that we should be using against this variant?
Yeah, so you have really 3 kinds of masks. You got the best mask is these KN95 or N95 masks. They're a little bit hard to wear and to be in for a long time and to do any kind of exercise or anything because they're so tightly fitting. Well, they're tightly fitting, that's because they work good. But on a long-term basis, it's tough wearing those. But if you have to be like in a crowded, you have to be in a crowded place. It's the best. If you can tolerate it, that would be the best mask. Then the next best mask is the little blue hospital masks, the surgical masks. They're disposable. They cost usually 50 cents or less. People wear them a couple times typically, but they're designed to be used once. That works pretty good. So those work in the studies that have been done, including a huge one in Bangladesh, looking at 340,000 people. In that study, it worked 40%, was 40% effective. Other studies have shown about 50%. So, none of these things are 100%. This is why you wear a mask, you stay with other vaccinated people, you don't go into crowded places, and you practice social distancing as much as possible. So, you put all that together and you're relatively well protected. But with this Omicron, look, 1 million cases yesterday. It's insane. So anyway, in that Bangladeshi study, the people that just wore cloth masks, now we don't know if they were multi-layered cloth masks or whatever. There's a lot of issues here, but that was only half as effective as the surgical mask. So you have the KN and N95 mask, surgical mask, cloth mask. So the simplest thing would be to just say, everybody wear a surgical mask. That would be the best thing, or something equivalent to a surgical mask. But I don't think any public health people are going to drill down and kind of mandate what kind of mask you wear. Any kind of mask is going to help. And in the 1918 flu pandemic, where they had mask mandates too, it was all cloth masks. They didn't have these little surgical masks back then. They were all cloth, and they worked then too. So, if you have a multi-layered cloth mask, that's better than a single layer. So you get to pick which one you want. I personally wear mostly the little surgical mask. And then if I have to go on an airplane or I have to be in a crowded place, I wear the N95. That would make the most sense to me.
Wonderful. And those were all of our headlines for today. And now we have some COVID questions.
Okay.
This one is all about the CDC guidelines, and I'm going to break it down, Dr. Murphy, into multiple parts. So to start with, the new CDC guidelines, does it apply to people that are exposed that have no symptoms, or people that tested positive and have no symptoms?
Okay, so that is both. It applies to both. So if you're fully vaccinated, so that means you had your 2 shots plus the 1 or the J&J and your booster 2 months later, you don't have to quarantine, but you're supposed to wear a mask for 2 weeks.
Wonderful. If you have tested positive for COVID and have
10 days, 10 days.
If you tested positive for COVID and have symptoms, how long should you quarantine?
So how long do you stay in isolation? That's called isolation. So if you have COVID, that you go isolation, not quarantine. So isolation, the current recommendation is 5 days. And if your symptoms have markedly improved or you're asymptomatic, you can come out after that and wear a mask for another 5 days, but you should be wearing a mask anyway. Right. So that's the current guidelines with no testing required. So that is being rediscussed, and they may put that back in to the formal guideline, maybe this week.
So you do not need a negative PCR to leave isolation?
No, PCR is a great test for diagnosis, but not for monitoring. So PCR can be positive for weeks. And in some people with immunocompromised condition, months. So it's not good, and it doesn't denote infectivity. It's it's picking up little molecular particles of the virus.
And our last question.
PCRs are not a good test to do for follow-up.
Right. And our last part to this question. This person is vaccinated and have not yet received their booster, but have tested positive with quite a few symptoms. Yeah. How long after they test negative should they get the booster, and should they even bother getting the booster?
Yeah, so they don't have to test to get out of this. That's number one. Number two is all they have to do, if they're eligible for the booster, now it's 6 months past the first 2, they can take the booster basically as soon as they're feeling better. So, and if they're due for the booster, they have COVID, breakthrough case there, just wait till they're feeling good and then go get the booster.
Wonderful. So that was all that part for one question. For our
Yep,
second question, for our second question, I'm going to sum this up the best I can. This 24-year-old is a frontline worker in Chicago and is fully vaccinated and has had upper respiratory virus since mid-December. In a sense, he has tested negative on the antigen test about 5 times and has had symptoms such as sore throat, sinus congestion, fatigue. He has had no loss or taste or no fever, but he has continued to have symptoms as such. He has now tested positive. What can you tell us about this finding of the negative antigen test and the positive PCR test?
Yeah, well, there's 2 things. One is that he could have had 2 different infections. He could have had a cold and had all those negative tests because he didn't have COVID. Then he could have gotten COVID. So that's one possibility. The other possibility is that some of these rapid tests are not as good as diagnosing Omicron. So he could have had kind of a low ongoing Omicron infection. But because he's vaccinated, Omicron is usually pretty mild in these people that have been vaccinated. So I think he probably had 2 infections. Doesn't really make any difference. He ends up with COVID. And then then the family is exposed. So they quarantine for 5 days after they've been with him. They don't have to quarantine, but they have to just be careful and wear a mask around him and stuff. And he needs to isolate for the 5 days from when his test was positive. And then at day 5, if he's asymptomatic, then he can come out of isolation. So it's a little bit confusing following all that. But
Right.
He's got to feel better. And, there's going to put new testing guidance in. It's going to come this week. So be prepared. The family's going to have to be prepared to go ahead and test. But certainly if any of them get symptomatic, they need to get tested.
Wonderful. Now for our third COVID question. If someone contracts and then recovers from Delta, are they now protected at all from, if someone contracts Omicron, are they now protected at all from Delta? If so, won't the spread of Omicron help to reduce the severity of the pandemic?
The infection from any of these coronaviruses is going to give you some immunity that will protect you against other variants. And it's the same is true for Omicron. And so, yes, but it's that immunity doesn't, unfortunately, with these coronaviruses, the immunity doesn't last very long, only about 3 months after you get infected. We start seeing second cases after as early as 3 months after somebody originally gets sick. So yes, you do get some more immunity, but it doesn't last very long.
Wonderful. And now for our fourth COVID question. This individual is 60 and in March they had a heart attack. They want to mix with an unvaccinated friend in a indoor setting. Why can't this individual who is vaccinated, 60, and had a heart attack mix with someone who is unvaccinated and also in their 60s?
This person is very high risk. Now she's only 60, but slightly elderly, heart disease, serious heart disease. This is a high risk person for a breakthrough. If she gets a breakthrough, she's a high risk for having complications and ending up in the hospital, maybe another heart attack or something worse. So unfortunately, the recommendation is to stay away from your friend until she's fully vaccinated and to let her know, don't put your health at risk just because somebody doesn't want to take the vaccine. Those days are over.
Right. And now for our last question. This individual and their husband got COVID the week after Christmas. It was a breakthrough for both of them, and they were fully vaccinated and boosted with Buza. They got boosted in September. They both had symptoms like bad colds with a cough and some chest congestion. Will they have strong immunity after they recover? And if so, how long?
Yeah, we call these patients hybrid patients. So they have immunity from the vaccine and including all 3 shots, and then they get COVID. So they're exposed to the virus again, different parts of it. So they'll have really good immunity. So it'll be interesting to see, how a person like this actually does. They may do better than the people that are just vaccinated. So they do get extra immunity from the infection.
Wonderful. Those were all of our COVID questions for today. Thank you, Dr. Murphy.
All righty. Thank you and Happy New Year.